Welcome. In this video, we'll be discussing erectile dysfunction, often referred to as ED. We'll explore what it is, why it happens, and what can be done about it. This condition significantly impacts the lives of many men and their partners, so let's delve into understanding it better. Erectile dysfunction has a wide range of potential causes. These can be broadly categorized as physical, psychological, or a combination of both. Physical causes are often related to underlying medical conditions. These include cardiovascular disease, which limits blood flow, diabetes, which can damage nerves and blood vessels, obesity, which affects hormone levels and circulation, high cholesterol, high blood pressure, Parkinson's disease, multiple sclerosis, hormonal imbalances, such as low testosterone, and certain prescription medications, including those for high blood pressure, depression, and prostate conditions. Psychological causes can include stress, anxiety, depression, relationship problems, and performance anxiety. The pathophysiology of erectile dysfunction is complex and involves several interconnected systems. A normal erection requires healthy blood vessels, nerves, hormones, and psychological well-being. When sexual stimulation occurs, the brain sends signals to the penis. These signals trigger the release of nitric oxide, which relaxes the smooth muscles in the penis, allowing blood to flow into the erectile tissues, called the corpora cavernosa. As the corpora cavernosa fill with blood, the penis becomes firm and erect. In erectile dysfunction, this process is disrupted. This disruption can be caused by narrowed blood vessels, preventing sufficient blood flow, nerve damage, hindering the transmission of signals, hormonal imbalances, affecting sexual desire and function, or psychological factors, inhibiting the brain's ability to initiate the erectile response. The failure of any component in this intricate system can lead to the inability to achieve or maintain an erection. Erectile dysfunction is a common condition. It affects men of all ages, but its prevalence increases with age. Studies estimate that it affects approximately 50% of men between the ages of 40 and 70, to varying degrees. It's important to note that this is just an estimate, as many men are reluctant to seek treatment due to embarrassment or lack of awareness. The actual numbers might be higher. Furthermore, the occurrence of ED is also associated with other factors, such as lifestyle choices and underlying health conditions, making some men more susceptible than others. Understanding the widespread nature of this issue is crucial for promoting open discussions and encouraging men to seek help. The primary symptom of erectile dysfunction is the consistent inability to achieve or maintain an erection firm enough for satisfactory sexual intercourse. This can manifest in several ways. Some men may be able to achieve an erection but cannot maintain it long enough. Others may be unable to achieve an erection at all. Some might experience reduced sexual desire, contributing to the problem. It's important to distinguish occasional difficulties from persistent problems. Occasional erectile difficulties are common and usually not a cause for concern. However, if the problem is frequent and causing distress or relationship difficulties, it's time to seek medical evaluation. Diagnosing erectile dysfunction typically involves a thorough medical history, a physical examination, and possibly some diagnostic tests. Your doctor will ask about your medical history, including any underlying health conditions, medications you're taking, and lifestyle factors. A physical examination can help identify any physical causes. Diagnostic tests may include blood tests to check for diabetes, heart disease, low testosterone, or other underlying conditions. A urine test might also be performed. In some cases, a nocturnal penile tumescence test might be recommended. This test monitors erections during sleep to help determine if the problem is physical or psychological. Your doctor may also conduct a psychological evaluation to assess for any underlying anxiety, depression, or relationship issues. While erectile dysfunction doesn't have specific types, in the same way some diseases do, it's helpful to classify it based on the underlying cause. We can broadly categorize it as organic, psychogenic, or mixed. Organic erectile dysfunction refers to cases where the cause is primarily physical, such as vascular disease or nerve damage. Psychogenic erectile dysfunction is where the cause is primarily psychological, such as anxiety or depression. Mixed erectile dysfunction is when both physical and psychological factors contribute to the problem. Differentiating between these categories can help guide treatment decisions and ensure a more tailored approach. Treatment and management of erectile dysfunction depend on the underlying cause. Treatment options include lifestyle changes such as quitting smoking, losing weight, and exercising regularly. Medications such as PDE5 inhibitors like sildenafil, tadalafil, and vardenafil, vacuum erection devices, which create a vacuum to draw blood into the penis, penile injections, which involve injecting medication directly into the penis to cause an erection, and penile implants, which are surgically implanted devices that allow the man to have an erection. Psychological counseling or therapy can be helpful for men with psychogenic erectile dysfunction. Addressing any underlying medical conditions, such as diabetes or heart disease, is also essential. In many cases, a combination of treatments may be necessary to achieve the best results. Preventing erectile dysfunction involves adopting a healthy lifestyle. This includes maintaining a healthy weight, eating a balanced diet, exercising regularly, quitting smoking, limiting alcohol consumption, and managing stress. Controlling underlying medical conditions, such as diabetes and high blood pressure, is also crucial. Regular checkups with your doctor can help detect and manage these conditions early. Open communication with your partner can help reduce performance anxiety and improve sexual intimacy. Overall, taking proactive steps to protect your physical and mental health can significantly reduce your risk of developing erectile dysfunction. The prognosis for erectile dysfunction is generally good. With appropriate diagnosis and treatment, many men are able to regain satisfactory sexual function. However, it's important to remember that ED can sometimes be a symptom of an underlying health condition. Therefore, it's crucial to address the root cause. Recent research has focused on developing new and improved treatments, including gene therapy and stem cell therapy, which hold promise for restoring erectile function in men who don't respond to conventional treatments. Additionally, there's increasing emphasis on personalized medicine, tailoring treatment to the individual based on their specific needs and characteristics. Continued research is paving the way for more effective and targeted therapies, improving the quality of life for men with erectile dysfunction.